inaugural edition of the Ivy Rehab Injury Report. Ivy Rehab with over 18 locations around South Jersey. And joining us right now to talk about the latest 76ers injuries is, he actually happens to be my doctor as well, Dr. Josh Lamb from Ivy Physical Rehab. Dr. Josh, how you doing today?
I'm doing great, Josh. So great to be here. I appreciate you taking the time and excited to talk about some of these injuries and hopefully shed some light on what's going on with some of these players and how they can hopefully get back to the court as soon as possible.
So we're going to start with Joel Embiid because obviously he is like the ongoing butt of jokes, basically. The guy's always injured. It's always something with him. And for those who don't know, the news just came out that he will not play tonight. So he is now going to be reevaluated this weekend. And Dr. Josh Lamb, I want to ask you because, what's interesting is that they initially listed him with a strained right oblique, but previously it was bruised ribs. So can you talk about what is the difference between a strained oblique and bruised ribs? Because I feel like there's some nuance there that maybe people might not understand.
Yeah, and it is somewhat of a subtle difference, to be honest. So if you see the injury, how it occurred, he was kneed in the side during play. And that for most healthcare professionals, we would immediately start thinking a contusion or a bruising type injury. It was right towards his ribs. So they would take him back. They would evaluate him. They would do what's called palpation, where they feel around, kind of trying to feel where is the pain coming from. And then they're also going to be doing some, muscle activation tests, selective tissue tensioning, we call it, in order to kind of assess where is this pain coming from, what exactly was injured. So those initial on-court, on-site assessments, they would think, okay, based on the mechanism of injury, how it happened, where he was hit, and where we're feeling that pain, their initial thought seemed to be that there was a rib bruise. But then when they did further assessment medically, they took him back, they did MRI, is my understanding, that would show a little bit more detail of where the inflammation is settling in. Now, inflammation is a normal and required and necessary part of the healing process. There are what we call stages of healing, where it progresses from the inflammatory stage to the proliferation stage to the maturing or remodeling stage. So that inflammatory phase is where we would expect the body to send inflammatory chemicals, immune system cells to go in and try to clean up the area and start preparing for that healing process. And so they're going to see on that MRI where it's kind of lighting up and where they're seeing that inflammation take place. And it seemed to them, based on the radiology report, that was more in the muscle itself. Now, there are two oblique muscles on each side of the torso. There's what's called the internal oblique and the external oblique. The external oblique goes up higher. It goes up to about ribs 5 down to rib 12, and it's going to create a lot more rotational movements. That's going to be your power. That's going to be your movement muscle, flexing the trunk, rotation, very important for basketball for these players. And then there's the internal oblique muscle. Now, those ones insert a little lower, just down more towards ribs 10 to 12. Internal, more of a core stability muscle. That's going to be an important muscle as far as back pain, as far as stabilizing the core and protecting the spine, things like that. Where he was kneed, where they felt like the ribs were, it was likely more an external oblique strain injury, which can happen from the impact causing the muscle to recoil, to contract aggressively. Now, these men are so strong. These athletes are so strong that sometimes they can strain their own muscles simply from contracting them so hard. And that seemed to me, based on the mechanism of injury, what likely happened. And some of the differences between the bone bruise and how they would diagnose the oblique strain.
Dr. Lamb, it's Michael. Question for you.
Yeah.
Up to a couple of years ago, it used to be if a player didn't want to play, very easily he could say, I'm having lower back pain or I'm having headaches. There was always something. But listening to you talk now about MRIs and this and that, can they still hide like that? Or is it those days pretty much done that if you're saying you're hurt, they know if you're hurt or not, or you're just saying that kind of thing?
Yeah, there's always going to be a little bit of a subjective component to pain, how people perceive pain, but they can see in the MRI. Now, the MRI wouldn't show microscopic tears, which is typically what we see with a grade 1 sprain. It can show like areas of inflammation and give them clues and hints, plus the palpation, plus how well the muscle's contracting. There may be some visible bruising. I haven't seen any reports that there is. Perhaps there is. I don't know that. But oftentimes with some of the higher grade strains, there would be visible bruising. So these are some things that they could see. But certainly there's definitely a subjective component to pain, how people respond to pain. But my hope is that these players, they want to get back on the court. The 76ers need some wins. They need to get out there and get some of their star players back up. I would imagine that that Joel Embiid wants to get back onto that court and help get some W's for the Sixers.
Talking with Dr. Josh Lamb from Ivy Rehab, the Ivy Rehab Injury Report here. First-class physical therapy care with over 18 locations in South Jersey. So what is the rehab that goes into an oblique injury? Because it's such an injury that maybe most people would never even think of having, but it's one of those, if you've had it, you know it, right?
Yeah, and it can be painful to, any movement of the trunk, especially in athletic type play, can be quite painful. So they're going to be looking at trying to manage that pain as quickly as possible. They may be doing some things like ice and non-steroidal anti-inflammatories, ibuprofen type medications. There's a negative aspect of that, though. They may not want to overdo that because that does inhibit and impair the inflammation process, which, yes, helps reduce pain, helps us feel better in the moment, but it can slow the healing process. Because remember, that inflammatory phase is a necessary and required part of the healing process. And if you slow and delay it too much, that can make it harder to get back to play as soon as possible. So some level of trying to move through some discomfort, some level of trying to activate and engage these muscles under a lighter, controlled load to improve circulation, blood flow, flush out waste products, help those cells get in there and start laying down healing and recovery. Now, the beneficial thing is that muscle does tend to heal a little bit faster than bone in general. It's a very, fleshy, it's a very vascular, lots of blood flow type tissue, and it does heal relatively quickly, as opposed to some more connective tissues or bone tissues, which are much more dense, fibrous, hard tissues. It takes a little bit more time to rebuild and remodel and create strength back in them. So after they get the pain under control, they're going to want to start creating movement, whether it's passive range, gentle manual stretching with some of the trainers or therapists, self range of motion, active range of motion, muscle engagement, often starting with isometric contractions in a mid-comfortable range that gradually progress to harder and harder contractions. And then once we're able to do this type of strengthening exercises, side bends and crunches and things like that, then start simulating actual play. Now, he may already be to the point where he's doing some practice and doing some play, but it's going to be in a controlled environment where there's less risk of him restraining. And that really is the risk here, is the tissue is temporarily compromised, and likely he has what we call a grade 1 strain, where it could progress to a grade 2, which is a much larger, much more aggressive tear, and that can take even months to heal and recover from. So they want to make sure that they allow the tissue to heal, strengthen back up, and get to play safely as quick as possible, which can take possibly a couple to a few weeks in a grade 1 strain.
Let's switch over to Sixers rookie VJ Edgecombe. So he sustained what's called a lumbar contusion, a lower back bruise. He got fouled from behind, which we were saying earlier in the show. They probably should have called like a flagrant 1 or a flagrant 2, but they didn't, because it's a pretty dangerous play. But either way, what is the differences for you that people need to know about what exactly is involved in a lumbar contusion and what exactly goes into recovering from something like that?
Yeah, it's very interesting when you see it was a pretty interesting foul, the way he was up in the air, turned, fell down on that kind of the right, if I recall, was the right kind of hip, sacrum, pelvis area, right in the low back area. And it was a pretty hard hit. So that's going to cause, impact damage. Contusion would be, what we would call in the medical profession, a bruise. Now, was it a soft tissue bruise? Did it bruise the muscle and the tendon? Was it a bone bruise, which can be a deeper, harder, a little bit more painful, a little bit longer recovery? The way he landed, it certainly looked like he could have some bruising on the pelvis, perhaps the lumbar spine itself, the vertebrae. And a bruise is defined as the blunt force trauma, breaks blood vessels, can cause discoloration, pain, and swelling. And a bone bruise can damage the matrix of the bone, which at a microscopic level, when they did also an MRI for Edgecombe, they must have ruled out a fracture. I'm making some assumptions. They ruled out a fracture, any kind of dislocation, any kind of muscle strain, sprain injury. Those would be some of the differentials that they'd be looking at. And again, they're seeing that inflammation in the area without physical anatomical breaking of the bone or the other tissues. So similar to the lower grade muscle strain, they're going to want to try to get that pain under control. They're also going to want to be a little bit cautious at first with high impact. They're going to want to allow the bone to work on recovery and remodel from any micro traumas that may have gone through it. Because the last thing they would want is to have a hard impact on that bone, which could then progress into a more true fracture, which would be a much, much longer recovery.
So then, for a guy like VJ Edgecombe, he's a bouncy athlete. He's explosive. He's dynamic. How can the recovery from this limit him? So, for example, a guy might be like, oh, I can come back, but I'm not 100%. Like we saw Jason Tatum last night in the NBA return from an Achilles injury, and he actually missed a dunk last night. It was actually kind of funny. Like he didn't realize I'm not all the way back, right? So for a young player, they kind of recover, right? Those 18, 19-year-olds, they heal a little differently than people who are older. But the athlete might be like, I'm fine. But so how this limit even someone who's an 18, 19-year-old returning to play?
Exactly. And the healthcare professionals, the trainers, the doctors, and certainly the coaching staff as well, they've got to keep in mind the risk to reward ratio of getting someone back potentially too early. There is going to be some impact to play. There's going to be some impaired performance with pain, with stiffness, with tightness as things are healing. But in this situation, the likely biggest danger of going back too early would be to sustain another fall in the same area and suffer a much more significant bone injury, such as a fracture, because of the compromised level of the healing tissue. And so that's the pro and con that they're going to want to weigh. So if he's out there getting back, they need him on the court. They need to, like I said before, to get some of those wins. That will be, I would imagine, with some instruction, some thought of, okay, let's be a little careful. Let's be maybe a little less physical, so we're not getting knocked down and landing on the same area again. But once he's able to handle the pain, once he's able to move through a good range of motion and perform under controlled environment with good technique and good level of play, he should be able to get back on the court, I would think, within probably the next week or so. But with that thought of, okay, let's just be a little extra careful that we don't land on that same spot again, because it can be a couple more weeks before that bone is really, really strong and fully recovered again.
And again, let me remind folks, the Ivy Rehab Injury Report, Josh Hennig, Mike Carlin, the Tropicana Showroom in Atlantic. Talking with Dr. Josh Lamb, Ivy Rehab, first-class physical therapy with over 18 locations in South Jersey. So if someone came to you and they had this type of lower back bruise, maybe someone fell at home, maybe someone was playing basketball, maybe someone was playing basketball at the local rec center, right? What is kind of like the method of, hey, you came to Ivy Rehab, how will we handle this back situation?
Exactly. So yeah, we would get you in. We would do a thorough and efficient physical examination, taking any medical treatments or evaluations that have already been performed into consideration, whether you've had an X-ray or an MRI ruling out any kind of fracture. We would be looking for red flags. We'd be looking for signs of a fracture that might need us to refer you back to a doctor. And we can do direct access and physical therapy in New Jersey. You can come straight to us. You get injured, you fall, you come straight to your physical therapist, and we will know whether you need to see a physician or whether you were able to do direct physical therapy care right away. That way we can get you feeling better as quickly as possible. After that physical evaluation, we would be assessing to see where the limitations are, where the injury is, what's tight, what's hurting, what's become weakened, and what muscles have become impaired or inhibited because of the injury. And then we would do, physical hands-on manual therapy techniques, range of motion, exercise techniques to help get you back as quickly and safely to whatever your goals are, whether it's sport, whether it's work, whether it's hobbies, getting you back to living your best life.
And Dr. Josh Lamb, before we let you go, obviously, the people who know me, like Mike Carlin, want to know what kind of patient I am. Everybody thinks it's hilarious that I actually have bit the bullet and been an adult and actually gone and gotten help. So
have you done your stretching for him?
I did it this morning.
Okay.
I have to do it when I first wake up in the morning.
You're doing your homework. You're doing your home exercises. You're staying on top of it. You come into the clinic, you work hard, and we make it a fun environment. We come, we laugh, we work hard, we get it done. And hopefully you're starting to feel a lot better, Josh. But we certainly love working with you.
Well, certainly the range of motion of my neck has improved greatly since when I first came to you. I remember I could barely turn my neck. and now I actually can turn my neck again. So I'm pretty close to the finish line at this point.
Yeah.
Doctor, what I'll say is thank you for explaining it the way that people can understand it. Because sometimes doctors can explain things and it just goes right over our heads. I just want to just say thank you for explaining with Embiid what exactly he's going through, and now we have a better idea of what timeline and what could happen down the road. But just thank you for the way you explain it is perfect for everybody, for our listeners.
Wonderful. I'm so glad to hear it, and you're very welcome. It's been wonderful being with you guys today, and talking about these athletes, and hopefully we'll get them back on the field. On the court as soon as possible.
Or maybe in the field. Who knows? I mean, depending on how the offseason goes for some of the other teams.
Preseason football season. Next week, baseball season.
I'm still thinking about the football season.
you and everyone else, right?
Yeah.
Dr. Josh Lamb joining us from Ivy Rehab, the Ivy Rehab Injury Report here on Hanging with Hennig on 97.3 ESPN. Dr. Josh, we'll talk soon. Well, I'll see you next week, and then we'll talk next weekend.
Absolutely. Thank you so much, guys. Have a great weekend.
Yeah.
Josh Hennig, Mike Carlin, Hanging with Hennig here on 97.3 ESPN, broadcasting live from Tropicana Showroom in Atlantic City. Again, Ivy Rehab with over 18 locations in South Jersey. Best-in-class physical therapy, rehabilitation. They are the best. I go there, Mike Carlin, and other people should go there because, listen, as I get older, I've learned the hard way that, I can't just, rub some dirt on it. I can't just, suck it up, taking some pain medication. You always have the pain medication. And sometimes the pain medication blocks you from being able to fully heal.